disorders. Basically, these are the pain related conditions. Pain may be due to general stress that causes muscle spasm. Any inflammation can lead to muscle spasm, and that can become chronic, or it can be a sports wear and tear, or RSI, repetitive stress injury, or it can be arthritis related, some kind of a degeneration, whether it is back, neck, knee, or any pain like shoulder, rotator cuff, any of these things, right? That's the general category when we say musculoskeletal disorders. It can also come under arthritis and so forth. So here we are simply talking about pain. Pain may have many reasons behind it, which we are not bringing here, just to give the premise for this. Now, what is the principle of yoga therapy behind, as of now, we'll focus a little more on back and neck pain. We won't cover the knee too much because remember we did chair yoga and the gentle chair yoga practices. We still haven't done the blocks yoga. No time this time. Maybe we can do it tomorrow as a after the class. We can do it. We'll still keep it around. Tomorrow we'll have a gentle restorative yoga using the curved blocks, which is just more of a techniques for you to just consider. May or may not be possible everywhere because you may not have those blocks everywhere. Okay, coming to integrated approach of yoga therapy. Yoga therapy, once again, is different from yoga classes. What is the difference? In yoga classes, you assume a healthy crowd. When we say healthy, we know clearly now it is not healthy and unhealthy. There is nothing like health and non-health, right? We understood that already. Relatively healthier crowd where the pains are not bothering them too much and they can stretch and get out of their pain. In that case, we don't worry and they will do per their comfort. We still give those advice to listen to their body and whatnot, but we are not bothered about treating their particular condition. Yoga is yoga, it helps everybody improve, the health improves and then they feel better, that's fine in a yoga class. It still helps their conditions. But in case of yoga as therapy, our goal is much more specific in terms of therapeutic effects of yoga. Here, our goal is not to simply give them practices after practices, making them stretch and twist and bend and, just in all levels, just push them so that they just feel okay, serotonin and dopamine, everything just got produced because exercise happened. That's not the focus. That is the focus of a gym in general. That's not the focus of yoga anyway, but more so in therapeutic yoga practices where we are working on giving them very gentle but yet very powerful practices, targeted, focused on their condition. So they are gentle because of many reasons. That is, exercises, although they are good for you and everything, when you push beyond your capacity, when you push the envelope for pain threshold, then that causes stress. If I cannot do something and I'm made to do that, then that causes mental stress. Remember that. And the people who come to therapy, yoga is therapy and not necessarily going out there to do their regular exercise, are coming because they know that you are going to help them with their condition. That means, why did they get there in the first place is the number one question you have to think in the mind. They got there for many reasons. Could be because they never exercise, they never go to any of these yoga classes, or they have some strong notional problems inside and maybe some kind of a mental issue going on which leads them to, it's a stress response, maybe some trigger, something triggers them, sure, but the response is probably an overreaction to some adverse situation, like we discussed all these things. So they are stressed out. That is the main reason for their coming here. Remember that. That's the sole reason why they are in that trouble. Stressed. That is results from the mind. That means what should be the goal? To make them relax. First thing. And they have less mental strength compared to, let's say, a person without relatively free of diseases. They have definitely, their reaction to the adverse situation is much more, and they hold on to things much more and whatnot. So the mental strength being less, they are less tolerant to the stressors. We want to not stress them in the class, so they cannot take too much of burden of practicing heavy yoga practices. That's the premise we have to take. And then that doesn't mean that you should not make them do more and more, which is needed. Whether it's holding in say low chaturanga, that's not easy. The low plank that we did at the end is not an easy pose. But what she was saying is just come up and then bring your knees down and come down, relax, and then go back again. And then come down and then go back again. But in a regular class, we may say, okay, now I'm going to start a clock and we'll all stay there for 1 minute. We'll be sweating and we'll be struggling and whatnot, and we'll still try and stay there, which is good, fine. For that matter, if you ask all these people who have come to therapeutic classes and you made them practice that, they will love it. They will say, oh yeah, I want to do that. But it's a temporary euphoria they have, right? But the ability to tolerate stress is already low for them. So that won't last. Then they will say, oh, my back is hurting now. This is too difficult of a class. I don't want to come. Maybe not today because I'm not feeling so well today. It's too much. The class itself becomes like, okay, am I healthy enough to go there today? Maybe not, because my back is hurting a lot. So there is more reason why they don't want to come. Once they come, they feel better. That's a different story. But they'll find more reasons not to come. But if they came to the class and they felt relaxed and they had a little sleep, like what our friend here had, they will say, oh, it's okay, I can go to the class. Even if I'm sick, oh no, I have to go. I'm not sick in the sense of real sick, but a little pain here. My pain has increased a little bit. Should I go? Oh, actually, they'll remember, oh, at the end of the class, my pain actually went away. And that whole day I was pain-free. Oh, I should go. So there should be a motivation carrot for them. So these are all reasons why the class that is much more gentle is so much more powerful. That, however, the crowd doesn't understand that, and there is a lot of hesitation and this and that, and even taking the first step. That is there. We know that. That is there in the psyche. The more difficult any class is, the more higher the level is, the heated room and twisting and turning. Yeah, I like to go there. That is the general tendency. But you have to know that these provide equal, if not more, benefits by just simply using those supine and prone practices. For the most part, we were like lying down. But look at what all we did, just simply lying down. Okay, so it is an integrated approach. We work on all different layers, very subtly, but we work on all different layers. It seemed very much like just we were doing physical practices, but look at the number of chants that we did, the number of times she was just insisting on, relaxing, observing. In fact, we do even more. We were time pressed, but because of the techniques that we need to finish. But each of these, you just give them and you ask them to observe, you give them, you ask them to observe. The more chronic, the slower the practices. And those pelvic tilts that we did, simply just lying down with feet on the ground, close to the buttocks, just simply pushing the pelvis down and releasing, pushing it down and releasing itself is with the breath. Just very powerful practice for acute back pain. They will just love it. And then lifting just a bit and then pushing down again in Setu Bandhasana, but very tiny Setu Bandhasana. That is what we do, and then make them practice MSRT. This is it for acute back pain. Within 4 or 5 days, they are ready for more asanas. Just 4 or 5 days. and they would have had that acute back pain for years. This is how powerful these practices are. It's just that they don't know the relaxation, they don't know breathing. The pain is feeding into their stress, stress is feeding into their pain, and it's a vicious circle. This is how they are caught. And they think life is useless because, full of pain. And because life is useless and full of pain, the pain increases because now you are stressed out. Okay? Now, what are the practices of Annamaya Kosha, Pranamaya Kosha? You already can see that. We'll keep covering these practices. That is, for Annamaya Kosha, it's asanas, kriyas, that is cleansing, and then diet, very, very, very important, because sugar, big time sugar, the biggest inflammatory agent and the biggest addictive substance on the planet is sugar. Not cocaine, not marijuana, nothing, just sugar. And this is freely available as much as possible. No government throws any restriction. You can go to any state, any country, and you can consume it as much as you want. And that's the worst disease on the planet. And how to make them come out of this craving, whether it's sugar or gluten or fried food or junk food, whatever it is, it's the relaxation. The day they practice yoga, they can try and control their sugar intake and gluten intake and all that stuff. So diet. And then comes the mudras, bandhas, all that. In the back pain session, we try and not do too many of those because they are a little more advanced practices. Initially, just what we just did with breath is great. Okay. In general, at Annamaya Kosha level, we do all this. In Pranamaya Kosha level, breath is the handle to the prana. So breathing, breathing, and breathing. Manomaya Kosha level, we have this Nadanusandhana that she conducted at the end today. Of course DRT, but sometimes meditation techniques such as the mind sound resonance technique, pranic energization technique, or simply cyclic meditation, and the practices of Sahaja Pranayama as meditation, sectional breathing as meditation, simply a small portion of PET, that is Mudra Pranayama as meditation. Take any breath watching as meditation. Just bring some meditative aspect, mindfulness aspect in every class. Then comes the Vijnanamaya Kosha level, happiness analysis. In yoga as therapy, when you give yoga as therapy, you're not just going to have the individuals come and do the classes and stand. No, we always bring some sessions in between where we talk the concept. You can have them initially, of course, as soon as they come to you, there should be an hour or two of this, what we call orientation session. We say, hey, you all have to come to this one private orientation session where we talk about what is yoga, how it helps, all that integrated approach of yoga concepts, which I haven't seen anybody doing assignments. How many of you have done that? Good. Okay, couple of them. 3. Good. Do those assignments, because you will be saying that repeatedly over and over and over again, how these are integrated practices. If we simply conducted the class that you took today, can become a very mechanical class saying, hey, I did all these practices and I chanted these practices and it felt good. Why it felt good? What can I do to empower myself so that I don't have to have Savita in the class every time I have to have zero back pain? That should be given to them. Otherwise, it's not yoga anymore. It has to go deeper and deeper into their psyche and saying, wait, this is why I'm feeling good, because now I'm in the present moment. I'm not thinking of all these thoughts that I was thinking. For the most part, we treat every patient that walks in. We don't like to use the word patient, but for the sake of talk, we treat everybody as mental patient. Yes. Unfortunately, we don't call, that's a label given by clinics, and they categorize somebody as normal people and mental patients. Like we know, everything is a gradient. So who is mental patient, who is not? We call some children ADHD. Yeah, can we have 20-second focus on something without having a distractive thought? Not me. Then I'm ADHD patient. So you have to know that this clinical and subclinical, we are all subclinical mental patients. So that's how you have to look at it. Then Who is not the mental patient? Maybe somebody like Buddha is not the mental patient. Somebody like a monk who has been meditating is not a. Rest of us, can we control our mind fully, completely for at least 15 minutes? At least not me. So that is how we have to see this, because they are coming out of, coming from stress as the factor. We have to start working on all these reasons for stress. And one of the biggest places where stress starts is the mind and manomaya kosha, the thought layer, that is, sorry, the feelings layer, the likes and dislikes. That comes from notions. I like this is a notion. I hate this is a notion. That person is bad is a notion. Because there is nothing like bad, nothing like good, nothing like any one label that we give. It's not. The bad person may have many other good qualities. The very good person may have some of the worst vasanas. So now how do you categorize them? But don't we always have that judgmental attitude to some extent or the other? Some, again, degree varies. But we do have that. We do feel okay with some people, not so okay with some people. That samadrishti, panditaha samadarshinaha, is not going to be so easy. But without that, there is no therapy. All the techniques are simply like, you stretch the rubber band and, it's like, what is that? Sorry, putting the
Strap.
dog's tail, right? You put the tube and then it will straighten, you straightened it in the class, then they went back and again they next came with the same dog's tail. That's how it's going to be, and your job is great, secure, but unfortunately they are not going to come very long. They'll say, yeah, okay, whatever, and then they'll spiral down as usual. They'll come and go, but they are not improving at all. Our goal is not that. Our goal is for them to eventually take yoga teacher training and then spread the knowledge. That's the point. So we have to enable and empower them. And that happens only if you start working on their notional corrections. And that is why we like this integrated approach of yoga concepts to be taught to them. So we start with that counseling session, spiritual counseling. And then when we say spiritual counseling, we don't use that word too much. The idea is to be able to give them that big picture of life and to be able to apply it to their personal problem. We don't really go into their personal problem and try to give them some ideas and stuff like that. People do come with problems. They'll discuss their problems with you, and you have to be empathetic to that. Be a deep listener. So you don't say, I'm sorry, you cannot talk your problems to me. I'm not a counselor. Don't say that. It's okay. You are already a counselor. We'll come to that also later, what is yoga therapist role. But you basically listen. You don't offer anything in particular to that particular problem. You don't say, yeah, you are going through all these problems. Maybe you should consider divorcing your husband or something. Nothing like that. You just give them a big picture of life. Okay, that is the idea. Okay, how about if you did these 5 things? How do you feel? How about, there is a paradigm that is, can I talk about a paradigm that can be used? So give them a perspective and a paradigm. And most of the stress is due to one of these family members in the house, or mother-in-law, or child, for the most part children these days. So just giving them the perspective that Khalil Gibran's statement, children have come through you, but they are not made by you. They are not created by you. Some things like that, and see if you can just detach yourself and see how you can, how it feels. Sometimes using certain anecdotes, examples, sometimes personal examples, unless they are nothing too personal, but something at a high level. If you can just provide that at a very high level, not addressing any given problem, that might bring an aha moment to them. Spiritual advice is always welcome in yoga, or for that matter in the world. World has been operating that way. Even neighbor, you go to neighbor and talk about the neighbor about your problem, they'll give some spiritual advice, which is fine. I just want to give one example and then move on. One of these women who was very much oppressed by the family members, mother-in-law in particular, this was a village where she goes to the mother-in-law doesn't even allow her to go anywhere too much. She went to fetch water, and meanwhile there is a sadhu sitting there, and she goes and talks to him. She came and told my mom, and my mom brought this, and she was saying, telling me. So she goes. She has like a minute to go, because if she's late, the mother-in-law yells. So she says, goes, salutes the Baba, and she cries, and then he's just there watching her, and he says, this is what is going on, what shall I do? And really, mother-in-law pressing her so much. She says, yeah, and she has that pot, the copper pot. And she says, how do you wash that copper pot? She's like, yeah, I wash with the tamarind. You know? She takes tamarind and she washes that every day. I use the tamarind to wash that. When you use the tamarind to wash the pot gets cleaner or the tamarind gets cleaner? She says the pot gets cleaner. Okay, go ahead, be the pot. Let her be the tamarind. That's it. And then she gets up and goes. She later moved to closer to our house, and she was telling my mother, and she was saying, that was an aha moment for me. Be the pot. Let her be the tamarind. That's it. Just simple, whatever she was doing, and he just took that example. He didn't give her anything huge. That is how a wise person can be, and that's how we all can be. It doesn't take a long list of big advices. Just those little perspectives, gems of those little perspectives that we can give just watching day-to-day activities that somebody is doing. That's what spiritual advice is all about. Okay, so that is the work on these happiness analysis and notional correction. Sometimes we have these notions, and just turning that and looking at the same thing in a different way can give us a different perspective. Okay, now coming to back pain practices, contraindications, acute forward bending. Jyoti's gone to pick up Harry now. She's gone to pick Harry. She'll come. Sorry. Harry is her skeleton. She calls Harry. Okay. So now, what are the back pain practices? What are the principles behind back pain practices? One is, don't increase their back pain, whether you decrease or not. Okay? So contraindications. Acute forward bends, especially with legs straight. Why did we say that? Remember, we did acute forward bend in the Surya Namaskar, and this is how we did. So it still is forward bend, except don't keep the legs straight. That will put a lot of pressure on the back. And however, I just want to give you this. This one, wide leg forward bend, is not considered so bad for people without, again, everything is finally about how they feel. Because even with a disc herniation, we have seen that some people love certain practices. Acute forward bend, some people may like it, some people may hate it, some people may like backward bend. I used to always think backward bend is bad, like especially when you do too much. There was one disc herniated patient who she would say, give me any number of backward bend as much as possible, I'm fine. Just don't give me any forward bend. And there was, in the same class, the other one was saying, what? You want to do backward bend? I cannot imagine backward bend. Give me any forward bend. So she used to, so it depends on where the herniation is and where the pain is, which nerve it pinches and whatnot. So we don't know what hurts them, what helps them. That's why we do asana evaluation for every patient. So we have to also work on health evaluation. Are you able to get through that health evaluation? Okay, so we have to work on that. So we have a very comprehensive health evaluation. We'll talk about that. So this kind of forward bend and backward bend, we actually is suggested. Okay, keeping the legs wide, because that doesn't really work on the lower, bring pressure on the lower back. So some people may be okay with that, some may not be. So acute forward bend and even Paschimottanasana, we don't suggest that. All dynamic practices and jerky movements, we don't suggest that. All painful and difficult practices like say standing, sometimes even Virabhadrasana and all those standing poses we try and reduce initially. We don't bring a whole lot of them, although they are okay eventually, but initially maybe not. Okay. Straight leg raising also, we did a lot of straight leg raising with the belt and whatnot, right? Especially this one, and even this one, even this much they cannot do. So in case of evaluation, we ask them to, we do passive leg raise. That is, we hold their leg and we raise. And if they say it hurts, we stop. So passive leg raise is the evaluation assessment, asana assessment for people with acute back pain. They may not like leg raises. So you have to know, that's why what we did, we bent the leg and we raised, right? Even that they may not be able to do. Some people cannot do even that. So you have to know that back pain is a very interesting problem, and you have to first educate them before they even come to the first class. This class was already for back pain people with full awareness of their back and their techniques and what they can or cannot do. There will be no such class that can be called a therapy class. It will be really first 3 or 4 sessions will be just one-on-one sessions where we watch them, we train them, we tell them 100 times, no, this is not the technique, that's not the technique, no, this hurts you, I can see your face, you are crunching the face like that. They will say, are you okay? They'll say, yeah, and they'll do it. And we say they see their face and sometimes recognize, no, he or she is not feeling good at all, and this is not the technique they should do. But while lifting, they'll suddenly just a little jerk. What happened? Oh, there was a little pain, but now I'm okay. No, this practice is not okay for you. Things like that. So you have to be observing all of these. They have really bad awareness. They are not like us. We treat everybody like us, right? Which is natural, but you have to know. That's why it's very important for you as to become a therapist. It's not enough to listen to these lectures. This is just 10% of the entire session, right? Entire course. The 90% is in being in the field and practicing. And how do you do that safely? We cannot not train you and send, and you cannot learn at the cost of those people. So you want to learn to be safe, to be observing, how to observe, what happens. All of that is a lot of internship, by the way. You have to be with us to see what all we do. And so, yeah, it's like somebody's life is in your hands. You don't want to mess it up. Even simple Shavasana has contraindication. See that? Shavasana with legs straight is contraindication because they are not going to like that at all. And sometimes the pain is right there, which is fine, great. They will stop it. But sometimes the pain comes later. They finish the practice, go home, and next 3 days they are on the bed. No kidding, they are on the bed. We have had such cases where, Ashwini, I did not even give anything much, but then my client is now saying that 1 month he just didn't come to the class. And why? Because his wife said she has been, after that yoga class, he has been in the bed. This is something we have heard in Yoga Bharati itself, even with all these so-called gentle practices. So you have to know that this is a pretty serious business. Okay, so just Shavasana with legs straight is also contraindicated. We always ask them to bend their knees. That's why first few sessions we watch them and we see how their case is, and we tell them what they should not do. First is what they should not do. Acute neck bend, obviously, for cervical spondylosis. Remember what all we did there? No way, no way. They will have some shooting pain in the hand going. Yeah, it's no fun to get there. Yeah, I know.
What do you say for cervical spondylitis? Because Pavana Muktasana, everything requires your neck to be supported.
No, Pavana Muktasana they can do with their head down, right?
Down.
You can do it with the head down.
Yeah.
Actually, we didn't do any lying down neck practices, right?
Yeah.
But lying down, if they are not able to do sitting, we make them lie down and then do on the sides. So
We usually teach them, like when everybody's sitting here like this, that person will be going down here like that, and they'll be doing, see, the neck press. See, just like how we did back press, there is also neck press. Down and release. Down and release. And then they'll be doing the sideways like that. And they also do the neck forward and backward, just that much. Forward and backward. And then diagonal. Neck. Yeah. All these are simple neck practices. Very powerful. We'll do that next time. We'll take up, we need tons more time. I want to say this. We just need tons more time.
And they can do while sitting, will not suggest them to do like
If
that.
they have severe spondylosis, which we have had, just even this much is enough for them to feel that pain rushing through the fingers. There's a referred pain. There's a pinch in the vertebrae, right? C1, C2, C5. Yes.
So do you think like just giving relaxation sessions?
Yeah, but relaxation definitely.
Would that like first resolve that issue of some
Huh.
a bit before?
Very good question.
Then you can start off.
Very good question. Should we just give them relaxation? Like we had said earlier, right? In Vipassana, they say, okay, sit down, close your eyes, and done, right? For 1 hour. Here, if we, similar thing, that is, if we just said relax and give them a lot of relaxation practices only, then they'll say, they'll either sleep through that, or they'll say, it's getting boring, and things like that. So they usually come with an expectation of something physical, always. So that is one thing that is to meet their expectation. The other is, they won't do anything because there is pain. And because they have no exercise, blood flow is not there, the muscles start getting wasted. All of that happens also, remember that. So you have to give them movements. You have to give them movements with breath. So what kind of movements? That is what this targeted therapy is all about. So if neck hurts, doesn't mean that they cannot do Pavana Muktasana Kriya, right? If they put their head down, right, fully, and they are doing this, and if that doesn't hurt their neck, why should they not do that? So the more they exercise, the better, because the blood flows all over the place, and then the muscles become strong, and that causes overall improvement in the health condition. Then that solves their neck problem. So let's go here. Next slide. This leads beautifully into the next slides. That is, number one principle, relax the muscles that are hurting. Then improve the flexibility, build up strength in the muscles. So, how do you relax the muscles? That muscle, you just bring lots of awareness and relax that part of the muscle. But then also improve the blood circulation by moving all the muscles that are around it. And all the practices that can be done without involving that muscle, work on that. So, pelvic tilt, for example, right? Very simple back pain practice. What happens with that pelvic tilt? That is to lie down here and press the abdomen down here like that, crunch the abdomen, press the spine down and release. This is all they are doing. And we ask them to do at least some 4 or 5 times every day, up to 10 times every day. If they are simply lying down, we just say, okay, don't worry about it, just lie down. Don't lie down on the bed, but also don't lie down on the hard surface. Take something a little softer, lie down there, and then practice some 10 to 20 of those pelvic tilts. And what happens with that? When you crunch here, you are developing strength here. And then you are pressing down, all these muscles are getting their stimulation. And then you release, they are getting their relaxation. You press again, they are getting their stimulation. Here you are relaxing. Lots of prana is now flowing into that area because your mind is all into the abdomen and the back. So this area starts feeling better. Just in about 4 or 5 days, they are anyway bed bound because their pain is so bad that they cannot move and do much anyway. They are sitting and doing this, breathing and pressing, and slowly they'll be able to lift a little bit, and just a very small Setubandhasana that improves their glute strengthening. Now you are actually causing all the muscles to grow strong around the back, and within about a week they are ready. Dr. Nagendra is the Guruji. Dr. Nagendra, Chancellor of Vyasa, had come to Canada somewhere, and he was lifting a bag, and that's it. Disc slip, right? And severe pain here in Canada. And he never believed in taking any medicine, never went to the doctor. Now this pain, 2 days, 3 days, he was in the bed. And they were all saying, you've got to go to the doctor. He said, nothing doing, I'm not going anywhere. And he was just doing DRT for 3 days, just DRT, self-DRT and whatnot. So after 3 days, he was, at least the pain started subsiding, and he said, put me on a wheelchair, send me back home. And they sent him back to India in that condition. Goes to Prashanti and says to his sister, Dr. Nagaratna, see, this happened. They did the x-ray and everything, and they said, look, you have disc, slip disc now, and you have to get that traction thing, right? Only then you will get better, otherwise this can last, you can get worse. He said, how long? She said, maybe 2 weeks and then a week of rehabilitation. Okay, 3 weeks, right? Yeah, 3 weeks. Okay, give me 2 weeks. If I don't get well, I'll come to you. She said, what are you planning to do? Don't worry about it. She said, you are making a mistake. He said, don't worry about it. And then he said, give me only some simple juices and whatnot. He cannot even move. He's just probably came in first class or whatever. And they put him flat, and he was practicing all these. He said, I'm telling everybody to practice these techniques. I might as well use this on myself. And he practiced them in that pain. The disc slip pain is just unbelievable, right? He practiced DRT and then practiced this acute back pain practices and whatnot. 2 weeks. And then people are seeing him walking to the office. Slowly came walking to the office after 2 weeks without any medical intervention. I don't suggest this to others, but he's who he is. And he said, if I have to say this is the practice, I have to practice it on my own. And when he heard Kapalbhati helps you with this and that, and he practiced Kapalbhati for that long. Some, schools stopped practicing Kapalbhati, and he said, he was doing that when he visited our home. We heard him do Kapalbhati for like half an hour. We said, Guruji, doing half an hour Kapalbhati, we just went on, it was on and on. We could hear from the outside, right? He was in the room. He came out and we said, Guruji, you were practicing Kapalbhati for that long? Yeah, I'm trying. There are schools that are saying half an hour Kapalbhati is good for you. I want to try. How long have you been trying? Oh, it's been 2 months. How does it feel? Initially it felt okay, but now it's kind of plateaued. I don't know what are the side effects. I'll wait till that happens and then I'll stop. Okay, all right. So he's that kind of a person. Anyway, talking about the practices, the whole idea is to increase the pranic flow in all the parts of the body, and where there is inflammation, there is supposedly a lot of prana there, deviate from that side to other parts so that the inflammation comes down. If we want to talk in pranic language, otherwise you can simply say when all the muscles get strong around it, there is a better support for them, and then healing naturally happens. So that is the idea. Annamaya practices breath synchronized movements instead of holding them initially, okay, and stimulate the muscles so that the awareness is built, relaxation by means of awareness, then sankalpa, that is wish without expectation. Sankalpa is not, okay, I should get better, what's happening, why am I not getting, not that kind of a wish, but a wish saying, hey, here, a noble wish is sankalpa. When you really say, okay, I'm in harmony with the nature, and nature has the ability to heal, So that's how I'm going to heal. Why? For the larger cause, for me to be a Sevarthi and things like that. So when you bring that bigger, nobler cause, which you should instill in your clients too, by the way. They should not, everything should not be a transactional, yeah, I give you money, you give me this. No, unless it goes into spiritual levels, this won't be very effective. Sankalpa is that. Visualization of healing. Like, think of how you played basketball when you didn't have all this started. And become that. Vicarious pleasure is okay. And that itself will bring so much positive energy into you, and that also can help you in healing. The reason I'm saying all this is because you have to get into the mind of a person with pain. They are so depressed. Pain is not an easy thing. Everybody doesn't feel the same way about pain as, say, a yogi would feel. You would take that as an opportunity and practice something, accept it, and so forth. We have listened to all of this so long that we actually lose touch with reality. Frankly speaking, I want to say this for myself as well as for everybody, that we don't know how the world operates, because we are in such a nice la-la land ourselves, because we have to some extent conquered all these feelings of depression and whatnot. Pain for us would be, I liked quote was Beena said the other day, right? Menopause, we all women go through that. And I was discussing my symptoms, and she was saying, you just have to observe your hot flashes. This watching thing now, it's so cool. And it's so easy. I said, Beena, it's not so easy. Okay. It's so cool, yeah. It's so cool to feel the hot flashes and observe them and stay away from them. But it's not easy. For us, it has become so easy. Actually, that's how I was fine with that hot flashes. I was just, wow, okay. And in fact, my visualization was Sati. I watched that movie, right? There's that Padmavat. And how she enters the fire, like as if it's just some temple. And after that, I said, wait, yeah, we can do that. And I was observing my hot flash. Believe it or not, I had a feeling of samadhi with that. That's how this dukkha, sukha and dukkha, you just have to practice them. Huh? And I felt the same way with cold weather also. Once I was going in a freezing weather, and I was rushing to the car, and I said, what am I doing? Wait, let me take it. And that's it. I slowed down, and that just those 1 minute or 2 minutes that I took to walk were samadhi time. It was like a feeling of tantra. So we feel that way. It doesn't mean that we can expect others to do that. It's just very difficult for them to take the pain. Okay? That coming to sukha and dukkha. Sukha is the space you get. Dukkha is the constriction that you get, with which you get death. I'm bringing positive aspect to that, because when you have gone through dukkha of unlimited order, unfortunately women tend to go through this a little more, especially Indian women tend to go through even more, I guess. I have seen death in dukkha. I have seen breadth in sukha, where you are like, okay, free to go wherever you want. Here you are not free to go anywhere. You are pushed to the corner, but there is something deep in that corner.
Go within.
And that's
the
go
place you
within.
go.
Exactly.
When you have
Shoka.
nowhere else to
Yeah,
go.
exactly. So that's why even Ramayana, Shoka, that grief that Valmiki experiences, brings Valmiki in him, because otherwise he was just Ratnakar. When he saw the birds, the mating bird die, and he empathizes with that, he grieves, that's it. It brings spiritual ecstasy of a different kind. In fact, they say Shoka brings ecstasy, and which is true. I've felt it many times. So that and all won't happen in the case of person with the back pain. They are just very depressed, very sad, and now you have to sort of bring that motivation into them. That is why it's hard. So bringing these kind of visualization helps them lift up, temporarily, albeit, but that benchmark that you're giving them in the class oh, it's possible for me to be happy in spite of the pain, is the benchmark. Slowly they'll start working towards that. Okay, and supine pelvic tilt, we brought that. Flexibility, spinal muscles, hip and hamstrings. So stretch without stress. That is the goal of this. Like we said, any kind of practice also can bring stress, but without that, you just want to bring it so that they should learn how to push against their envelope without pushing too much. The reason they have gotten into that kind of a problem is because they have the tendency to either push beyond their limits or never take the chance to push at all. Some of the extremes like that, right? They'll say it hurts, I'm not going to go there. Or they'll say, hey, I have to do, look at that person doing, I have to do type A, something like that, right? You don't know what is their personality, but you will start learning their personality too, by the way. There was one lady who would push so much that every time she's in a class, I would need a substitute. Finally, we had to say you need one-on-ones only. No matter how much you give her training and everything, she would still push herself. How many? We have like 5, 6 people in the class and we cannot just stand next to her. No matter how much instruction, I would just say, no, please don't practice this, and I would go that side and she would practice that. Like, excuse me? No, I'll be fine, Ashwini, I'll be fine. And I know 100% she won't be fine, and she would come back and say she was not fine. Where am I missing here? This is how people are. We have such people. We do get such people. That's why they are in trouble. Okay. So I want to bring in concept of yoga here, right? There's a lot of deep stretches that yin yoga does, like really just allowing gravity to go there and stay there, and just simply stretching. Their goal is just doing deep practices. Slowly we can take our folks there too. Initially with breath and body synchronization, but slowly they can start moving towards, okay, I want my gravity to do it, I want my breath to do it. We say, as they lift, we raise our hands up like that. Sorry, which way? Yeah, we just say, let the breath take you. You're not. The breath is, as you inhale, the arm goes up. So it's the inhalation that's carrying your arm. That kind of a visualization. So that they allow things to happen, as opposed to that karta bhav, bhokta bhav and karta bhav has to go. Bhokta bhav is, I am doing it and I am enjoying doing it and I am in charge of myself. Two, that is initially the enjoyment, and then karta bhav, yeah, I'm just doing it. Let me relax on that bhokta bhav. But eventually, sakshi bhav. No bhokta bhav, that is no enjoyment as the goal for everything, reward based practices. The other is, yeah, I'm practicing, still there is ego in that, work for work's sake, that also there is still something going on there, just letting it happen. That is, I'm watching, the arm moves and I'm watching, the breath is moving the arm and I'm watching, that kind of a state. So just with these techniques, see where all you can take them, to what level of spiritual experience you can take them. For example, in straight leg raising, just gave some examples, but we can actually sit down and take this practice and we can train them, saying, okay, you have been practicing straight leg raising, take one practice each class and say, hey, at this time, let the leg go up and come down on its own. You are just watching the leg go up. So continue your practice at your own pace, listen to your body, watch your breath. Now I'm no longer giving instruction. Initially we'll say inhale, raise your leg up, exhale, down, and so forth. And then after 2 or 3, just take that practice and ask them to practice on their own. And when you have to stop, stop, but continue. Those who can, practice as long as you can, and just sit there and watch and just go around. If somebody is not doing their Ujjayi breathing, you can just say, can you practice your Ujjayi? Inhale, Ujjayi, and exhale. And if they are new, don't bother. Just let them practice first. Let them feel that. At least they are comfortable doing that. Are they breathing doing that? Or are they crunching their face and just struggling doing that? All of these things. Just observation. Just for about 3 or 4 minutes. And then move on to again, because otherwise they'll be thinking of something else. So you give them, you are like a hypnotizer, right? master who controls, ring master is the better word, ring master of their mind. So when you start the class drifting, then come bring them back. So teaching the class is profoundly spiritual experience. Keeping your eyes open, everything. Harry comes here, so I have to stop.
Say hi, everybody.
So yoga therapy for back pain, core, back and gluteal muscles, yogi crunches, Navasana, Chaturanga Dandasana, core muscles, Bhujangasana and Shalabhasana for strengthening the back, Setubandhasana variations for gluteal muscles, and some basic relaxation poses. Makarasana is a great relaxation pose. Shavasana, legs bent pelvic tilt for acute back pain. And breath coordination, stress from the mind percolates into the body through the breath. So if we slow down the breath, the mind becomes slow, and in turn metabolism slows down, digestion becomes normal, cells get proper amount of oxygen and so forth. These all we'll be repeating these everywhere, and we have a list of practices, just a basic list. We'll be preparing a master list, and this you can read, nothing too much in here. These are all basic tips. These slides will be everywhere, every time. Okay, I'm done. Ready for Harry?
Ready for Harry.
Yeah.